Good evening once again. My name is Rodney Mtunji, and we are going to continue from where we stopped yesterday, where we introduced the concept of public health nutrition. We saw the different, and we also appreciate the different people that we need. Then we also appreciated the different foods and the different chronic diseases that can arise from not eating well. So, today we are going to look at frameworks in public health nutrition, and these frameworks really make us appreciate how we are going to carry out our public health nutrition work. So they let us understand better the people that we are going to put these have effectiveness and efficiency in terms of what we do. So as you can see, we have basically three frameworks that we are going to interest ourselves in, and these frameworks can be used in other fields, but we are now using them in public health nutrition. So we have the social ecological model, we have the life. So when we talk about the social ecological model, we are looking at the social environment, in which people live. Okay, so and the forces around him and the way they to take up choices and decisions as far as nutrition is concerned. We look at as an individual as an entity that is surrounded by other things that can influence their decisions, from family to the community to the society. Those forces come together to influence this individual's choice on taking up either good nutrition or poor nutrition. So, for us to intervene or to put in place public health nutrition, we need to reappreciate all these forces. We need to know that if we are going to change the behavior of a person who has not been feeding well, feeding, then we need to take care of these forces that are influencing. Are they having a partner who can support this good nutrition, but also the environment that they live in? Does it have? We look at also the culture, as I said, the society itself influences individuals or communities nutritional practices. So we look at things like society norms, what is normal to them as far as nutrition is concerned. They could be people who believe that eating meat from Monday to Friday is something which is okay, or denying, for example, women some food which is nutritious. So those are the things that we have to appreciate whenever we are doing any program, any intervention, any policy as far as nutrition is concerned. The environment is also having the element of policy. For us to implement any intervention in public health nutrition, we need to make sure that there is a favorable environment in terms of policy. There should be policies to enable this public health nutrition to take place. Okay, there should be policies that tax those non-nutritious foods and beverages, or those that can cause harm to someone's health, and then channel that money, or that money from the tax, to making sure that we have subsidy on these better foods like fruits and vegetables. So those policies, uh, they are part of the environment, and they come in handy when we talk about this social ecological model. So as this infographic, it might not be so clear, but it tries to relate all those factors that we have been talking about: the cultural practices, the physical environment. Are you able to to get enough food and is it of good nutrient value from your physical environment, then the political emulate policies that can favor these public health nutrition policies or not. Then the gender constructs, like I was telling you, of great nutrient value. So those gender constructs and socio-ecological models. So all these come into play and influence an individual's choice of what to eat and what not to eat. And as public health nutritionists, we need to appreciate when we are putting up interventions, we make sure that we achieve effectiveness and efficiency by tackling each and every barrier, whether it is culture, whether it is political, whether it is gender related. And the other approach is what we or the other framework is what we call life course approach. And in this case, we are looking at someone from the day they are conceived to the day to that time every step of the way, the cumulative effects of those exposures over time, from when you are conceived to old age. What food do you eat? What exposures in terms of nutrition are you facing? Okay, you could have had breastfed because your parent died or your mother died, and that can affect your look at all that and factor and as we try to put in place these public health nutrition so we make sure that we look at the need. We also look at the needs and vulnerabilities of different age groups, because apart from appreciating how people grow and the exposures they could be having in terms of nutrition, we also we recognize that the needs of babies are different from the needs of old people, and those are also different from those of young adults or aging adults, so we from this life course approach we are able to see uh, what we are exist at each level of someone's development, so that we can put in place interventions that make sure that each and every person is catered for. So that is why we need this life course approach. Then the other one is we appreciate that nutrition is as a result of the processes. Okay, the food systems there, like food production, processing, management. So all these processes or all these systems, all these parts of this nutrition, or how a society's nutrition or how a community's nutrition is going to be. Okay, accessibility, affordability, quality, safety, diversity, and sustainability of these food choices for a different population. And these all arise from the other parts of the system that I was talking about. Is the community able to produce enough food throughout the year? Is everyone in their household able to consume enough food? You know, is it or a lot of processing of this food? so that we can always have a given community. So it's a guess that should be the community should be able to have food in enough quantities. It should be accessible. It should be able that we can have groups that we mentioned yesterday, but it should also be safe, and there should be that production that goes on throughout the year or storage, so that we can have sustainable food choices in the target population that we are looking at. So that is basically those are basically the frameworks in public health nutrition which help us understand people's choices as far as nutrition is that can be tailored to each community that we are going into, because different communities have different needs as far as nutrition is concerned, and these frameworks help us to understand that better thing in public health professionals. We have to understand that. So, in public health nutrition is concerned, and of course, we do this by making sure that stage as far as accessing quality food is concerned. So we make sure that those who have can maintain those good food, that good food quality, but those who do not have are also able to access afford, and also should be diverse in nature, so that we do not have those discrepancies that some people, because of their socioeconomic status, are able to suffer the the, the negative consequences of nutrition and compared to the others. Okay, so that is why we have to bring in the subject of equity when we are talking about public health nutrition. Called the bicycle framework in public health practice. So this is more of a complex framework that lets us know how we can when we are out there in the field, how in the best way. So it majorly has three elements whereby we do assessment, we do policy development, and then quality assurance. So in assessment, you basically identify the nutrition problems that exist in the community that you are targeting or the population. Break down these problems and you determine their causes, and also you make sure that you unearth those root causes of these problems. So you do this by collecting data on nutrition status of these nutritional problems. Then after that, we also do what we call policy development. And like I've been saying over and over, even from the previous session, we need favorable policies so that in this case we are developing strategies, guidelines, and interventions to address having children who are stunting, we are having malnutrition. And when you do your assessment, you discover that it could be because the mothers are not accessing food, and therefore they are not able to breastfeed their children for the first 6 months exclusively. So what you're going to do is put up a policy that enables these mothers to access food and also make sure that these mothers breastfeed their children for the first 6 months exclusively. That is a policy, and it makes the nutrition of these infants very easy. Okay, so policy development needs you to collaborate with all the stakeholders that have a say in nutrition, whether it is the government, whether it is those non-government organizations which are also concerned with nutrition, whether it is private businesses, whether they come in hand here when you are developing community, because the community knows what is their problem. They know, and they can suggest some solutions that they think can work. So when you're engaging or collaborating with stakeholders, you need not to leave the community behind. Then in assurance, you make sure that what you put in place is working interventions, and you see if they are working or not. At all times, you need to check and comparing it and comparing after a period of time to do this quality assurance of these nutritional policies and interventions. You start with what we call a baseline survey, or something like a baseline statistic or number. So you start at perhaps one, and then after you put in place your intervention, have if it is if you have been at one and you're still at one after after like a year, then there could be a problem, and that is why you need to always do this monitoring and evaluation, so that you can have quality interventions so as to solve those nutritional problems that exist. As a subject and as a field has been shaped by uh, a few declarations here and there, which majorly always bring together the UN member states, of which we are part, to make sure that we forge a way forward to have better nutrition. And these declarations are always like those guidelines to address those nutritional related challenges and promote overall population health, but also bring in the other aspect of equity. Nutrition to the populations, we should not leave anyone out. There should be fair distribution of resources and benefits, and then the risks. Okay, so we have declarations like the Alma Ata Declaration, we have the World Health Organization Global Strategy for Diet, Physical Activity, and Health. And like I was saying previously or yesterday, having good diet or eating well in that optimized way of eating those required foods in their required amounts is might not be enough, but you need also to support it with other interventions so that you can live a healthier life. And physical activity is one of them. As we're saying, we have other things like not smoking, reducing alcohol intake, and generally reducing also stress, or those those can lead you to having a distressful life. So we that is why this declaration of the World Health Organization Global Strategy for Diet, Physical Activity and Health is very important, and we shall see others that are important in this case of public health nutrition. So the Alma Ata Declaration has principles like primary health care, we have healthy equity, and community participation. So basically, as we go into the community to implement our health, our nutrition, our health, public health nutrition, we cannot do that without these principles or these guiding rules. Okay, we need to make sure that the community that we are going into participates in formulating or in making sure the intervention works so that they can own these interventions. And when they own, there will always be sustainability. But also, like I was saying, there should be fair distribution of whatever we are putting in place. It shouldn't benefit some and leave out others. Okay, then we should also utilize those existing use of those village health teams. Okay, so we need to build public health nutrition cannot exist in an unfavorable environment. So favorable, then we are creating can be easy to go. Also strengthen the community action. We need to make sure that the communities realize that they can take on these interventions and perhaps bring in our nutrition programs, and then when we leave, this community stops what we were preaching. Okay, in organization that generally promotes healthy eating deficiency, iodine deficiency, and the others that we saw yesterday. Health and well-being. Then the other one is the Ottawa Charter, which is a declaration for health promotion, and it generally uh, promotion in terms of nutrition, good interventions as far as nutrition is concerned. We need to do health promotion, and this you want to of what you want to of what your intervention is all about. So if it is about nutrition, you make them aware of what nutrition is. Okay, you make them thesis as far as nutrition is and be able to improve. What our charter recognizes the importance, of course, means that you have to put in place uh, nutrition policies. Then it also highlights the need for especially on multi-sectoral action. We realize that not going to intervene or to stop malnutrition other people. You need other people like the agriculturists who will tell you about the crops to grow in order to solve those malnutrition issues. You need sociologists who can make you understand why people from different you need the government to put in place those supportive policies. You need NGOs to also support you with expertise as far as nutrition is concerned. So it is more of a multi-sectoral accreditation according to this Ottawa Charter. Then the Rome Declaration recognized the right to adequate food, that to have adequate food, and it is basically a human right. Everyone should be able to access quality and adequate food by virtue of being human. And it also highlights the need for sustainable food systems, as we saw, seeing to distribution, all those should be sustainable in any community. And how do you do that? By engaging them into better practices of agriculture and also shifting from their what they used to do to better nutrition so as to improve their awareness on what to do as far as better nutrition is concerned. You know, when you're in the community and you engage them in a very what they know and why eat fruits because they cannot satisfy us. Okay. So then you tell them the importance of eating fruits, okay? So that they can always be a supplement on the food they have been eating, you know? So all this is done through appreciating these declarations and picking out those important key principles that they put out there. So emphasizes to deal with nutrition, we need to first greater chance of them not being able uh, to afford quality food or diverse food. Okay, so to improve their health or eat better food without appreciating their poverty levels. Okay, so poverty, and in reducing poverty, we can have better nutrition. But it also calls for cooperation internationally to address malnutrition and ensure food security for all. Then the last declaration is, of course, the SDGs, or as they took off from they are 17 in number, and they really focus on improving health and creating entire world. So basically, there are like I was saying, there are 17 goals, but as far as nutrition is concerned, we are majorly focusing on those three goals, and those include goal number two, which is about ending hunger. By 2030, we want to achieve we need to improve nutrition and promote sustainable agriculture. And like I was saying, we cannot have good nutrition without having better agriculture. Okay, so for us to end hunger, we need to put in place all these, making sure we have food security, whereby we have access to affordable and quality food throughout the year. Then we also improve nutrition by eating healthy food in the right amounts, and then promoting sustainable agriculture so that we can always have that food that we need. Then goal number three focuses on ensuring healthy lives and promoting without focusing on nutrition. As we saw in the first session yesterday, there are those diseases that arise from having poor nutrition. So, for us to eliminate or shield ourselves from those diseases and have well, and then goal number 17, that last goal, it appreciates or brings into light the importance of partnerships. Okay, like we're saying, nutrition cannot to have partnerships here and there from agriculture, from education, from the government, from governance itself. And even when you're intervening, you make sure that you partner with a lot of people that can bring to you expertise and also knowledge, so as to have a quality intervention. You need to partner with the NGOs, you need to partner with the community, you need to partner with businesses which are also focusing on nutrition, so as to have better nutrition. So that is it for today. We did not have a lot of uh, slides, but we really wanted to appreciate these declarations and frameworks that help us shape public health nutrition. And they really bring out this fair treatment of everyone. You shouldn't put in place a health intervention, a nutrition intervention that favors some people, these frameworks to actually affected. Okay, everyone who plays a role in nutrition should be involved. It is only then that we can achieve better nutrition for our society or community that we are targeting. So thank you so much for your time, and I will welcome any question at this point. Any question? I can see one student was answered that. I think he joined later. Do we have any question from you?
Okay, Mister, thank you very much. I would have a question to ask, but I've bit joined late. My network has not been okay. I was traveling from somewhere, so I've just catched up from on the way. But as we're going on, questions will arise. Okay, thank you very much.